name is Nishay, and welcome back to my channel. Today, I'm going to be starting a new series that's focused on Black women barriers with the healthcare system. If you haven't already, please go back to my previous episode where I tell you more about me, how I got started, and what really led me to this series today. Now, there are going to be a total of 5 points that we're going to hit in this series in the next couple of weeks, but today I'm going to focus on systematic and interpersonal racism. If you're not familiar with the definition, systematic racism ultimately is policies and procedures that are implemented in well-established institutions that can sometimes result in exclusion and discrimination to certain groups. Now, let's use an example of Black women. When it comes down to maternal mortality, Black women are 3 to 4 times more likely to experience a preventable pregnancy-related death than our white counterparts. Now, you may ask yourself, why is this the case? This disparity is often due to delay or inadequate prenatal care, lack of access to quality health care, and biases within the medical profession. So let's talk about actionable plans or unique approaches that can help when we address systematic racism. So there's 3 questions I like to address when I talk about systematic racism. Question number 1, when was this policy created? Question number 2, who is it created for? And question number 3, when was the last time this policy was evaluated as still an accurate quality of care standard? Now, addressing these questions really hone into some of the disconnect that we have as a healthcare system and with the Black community. For question number 1, when it comes down when it was created, a lot of times some of these standards and policies was created before a lot of us was even born. So when the world is constantly changing, why are policies and procedures not changing with it? Question number 2, a lot of people don't know that a lot of these assessments and tools and procedures are created to people that was able to have access to the research or to participate in this research, which is our white counterparts. So how can you create a standard of quality care, a tool or assessment that is based off of somebody that does not look like me to provide quality care for me and my family? On question number 3, when is the last time we're evaluating these standards with current research and changing it to be able to still allow quality care for everyone and not just one particular community? The next point that I want to hit on today is interpersonal racism in the healthcare system. So when we define interpersonal racism, it involves direct discrimination from healthcare providers. Study shows that 32% of Black adults report experiencing racial discrimination when seeking medical care. This is not only affects our current healthcare experience, but also our willingness to seek care in the future. Now imagine being in a vulnerable state and you don't want to go to the healthcare system because you feel like they're not going to listen to you. You're probably not going to make it out of the hospital, or they're going to have you waiting forever because they don't think your pain is serious. All these lead to misdiagnosis, inadequate treatments, and poor health outcomes in our community. So when we talk about systematic and interpersonal racism in the healthcare space, we talk about policies and procedures that are not created for the uniqueness of Black women and girls, and the communication or cultural competency that are lacked with our healthcare professionals to allow us to have healthier health outcomes. So what can we do about this? The first thing is that we can learn how to advocate for ourselves or place people in our lives that can advocate for us. Depending on some of the situations, I can understand that you may not know what questions to ask. And I live by this. We do not know what to ask until it's too late. We don't know what we don't know. So educate yourself or put yourself in communities or spaces that have health educators that can support you and allow your voice to be heard in the healthcare system. Another thing we can do is also implement ourselves into the healthcare space. I worked in the healthcare space for 9 years before I got into public health. And through that journey, I was able to connect with community members that looked like me, and they created that safe relationship. They knew me. They wanted to come back to the ER I worked at because they knew somebody that looked like them, but also cared about them and was educated enough to help them navigate the healthcare system and also allow their voice to be heard. So next week, we're going to be talking about distrust in the healthcare system, which go back all the way to the Tuskegee experiment. So if you haven't already, please make sure to subscribe to my channel where I talk about all things Black women health. See you next time.